As March marks the month of youth against HIV and AIDS, LGBTIQ advocates are calling for increased awareness, prevention and access to health services among young people. The campaign highlights the importance of HIV testing, proper adherence to medication and the use of prevention tools such as PrEP, while also addressing the stigma that continues to discourage many LGBTIQ youth from seeking health care. Activists say discrimination and fear of judgment in communities and health facilities often place LGBTIQ young people at greater risk, making inclusive health education and support system critical in reducing new HIV infection. The Botswana Network of People Living with HIV and AIDS, BONEPWA, says people living with HIV continue to face multiple forms of stigma in their daily lives, particularly those from marginalized communities. The national umbrella network formed by For People Living with HIV and AIDS in Botswana provides counseling and support services to individuals affected by HIV. In an interview with YTV, BONEPWA Evaluation Coordinator �WHO said many people living with HIV experience what she describes as double burden of stigma related to both their health status and their social identity. She explained that the organization's 2023 Stigma Index report revealed that marginalized groups, including members of the LGBTIQ community, continue to face discrimination and social stigma within society.
Here at BONEPWA, we are a national umbrella for support groups and community-based organizations for people living with HIV and those that are affected by HIV. Our primary mandate is to make sure that we look after the well-being of people living with HIV. We are focused on HIV NCDs as well as inequalities. That includes stigma and discrimination, it includes human rights, and it also includes gender inequality as well as GBV. So as BONEPWA, in terms of key populations, we look at people living with HIV pretty much in the same light. We look at people living with HIV in their diverse communities. We know that as people living with HIV, there are a lot of challenges that are faced, and those that are identified as key population have a double battle challenges that they experience. So what we try to make sure that we do is we don't discriminate between people. We try to make sure that we teach everybody about human rights, we teach about adherence of ART medications, we screen for GBV, we screen for stigma in order to promote stigma reduction. BONEPWA also did the Stigma Index 2.0 survey that was released in 2023 and done in 2022. This study is a global study that measures the level of stigma across the world. So in this last study that we did, we were primarily focused on making sure that we incorporate key populations within the study. So we try to encourage, we try to support by offering counseling, by offering psychosocial support in the diverse manners that are required, and we refer to ensure that people access services within their districts, within their communities, from the local authorities.
Meanwhile, a representative from Lesbians, Gays and Bisexuals of Botswana, Lekgabibo Laone van Vuren, said the organization is conducting a series of engagements during the month of youth against HIV and AIDS to empower and educate LGBTIQ youth about HIV prevention and safety. Speaking in an interview, Van Vuren explained that the initiative aims to raise awareness about the importance of regular HIV testing, prevention methods such as PrEP, and reducing stigma within communities. Vuren added that on the 20th March 2026, the organization will host a youth dialogue aimed at creating a safe space for young people to openly discuss HIV prevention, share experiences, and learn more about protecting themselves and others. The dialogue will also focus on addressing the challenges LGBTIQ youth face in accessing inclusive health services and encourage them to seek support and accurate information about HIV prevention and treatment.
We are planning we are doing a series of engagements for Month of Youth Against AIDS. We've already started putting out very key messages. If you follow us on any of our social media platforms, we've already started putting out messages around that. Questions around protection, particularly, and conversations around access to protection and treatment services. So we're asking questions like Maloba, one of the posts that we had, I'm a vibe type of question, and to get the conversation going around what the youth's attitudes are around protection, around commodity, safe sex commodities. And we're also asking questions around access. Is everybody able to access commodities and safety and protection feasibly and equitably, particularly for LGBTI youth? So we are also planning a series of activities that are going to be happening, one of which is going to be a youth dialogue that we're planning for the 28th of March.
An LGBTIQ advocacy organization, Success Capital organization, says the month of youth against HIV and AIDS should be inclusive to remind young people, especially the LGBTIQ, that they can feel safe and comfortable when seeking healthcare services. The organization knows that openness between patients and health professionals is important in reducing the risk of misdiagnosis and ensuring that individuals receive appropriate care. Founder of organization Dumiso Gata said Success Capital is currently conducting a community health program aimed at improving communication between healthcare providers and the LGBTIQ community.
HIV/AIDS is important to Success Capital, acknowledging the inroads that we've made in the HIV response, but also noting the importance of ensuring that young people are at the center of any response measures, whether it's prevention or even just treatment. And this is important because when we look at the statistics, there's a growing trend of young people basically contributing the largest in terms of new HIV infections. I think it's important for us, particularly when we speak about the LGBTIQ.
For his part, the program's coordinator of Botswana Trans Initiative, Raymond Golanyana, said LGBTIQ youth have the right to access health facilities without facing discrimination or stigma. Golanyana emphasized that inclusive healthcare is essential in ensuring that young people from diverse communities receive accurate information, prevention services, and treatment. He encouraged LGBTIQ youth to prioritize their health by undergoing regular HIV testing to know their status. According to Golanyana, knowing one's status is a key step in preventing new infections and ensuring that those living with HIV can access treatment early and live healthy lives.
I just the thing that I would say to the youth is that, you have the right to health, even though it may not be in your constitution, but you still have the right to health and you still have the right to access facilities and make sure that you get the treatment and the services that you need in order to live a healthy life. So even for the LGBTIQ plus youth, discrimination and stigma are still present in society today, but that should not stop you from seeking healthcare services and holding the people who provide these bed services accountable. Getting in touch with organizations such as Botswana Trans Initiative, Videographer, and others that work with LGBTIQ plus communities to, share your experiences with some of these health facilities and seeing how we can improve the services. But essentially, it is important for each and everyone to access health services so that we are able to reach our 95 targets when it comes to HIV. Botswana has been one of the countries that has been hard hit by HIV, so for the youth and for the LGBTIQ plus community, it's really important that we work on improving the service provision for them to be able to access their services, to access health services. I think particularly for the LGBTIQ plus community, because they're key populations, it means that governments and private sector has been working on initiatives that target key populations to try and improve their access to health facilities, but it has been quite a challenge for trans people in particular because the numbers are very low in terms of our data on trans people, how they access health facilities, how they're treated, whether they're getting services that are targeted for them. So we need more trans people accessing health facilities. We need more LGBTIQ plus people in general accessing health facilities. We need more youth accessing health facilities. So